they are delicate. Akleshasaha, in terms to the pain, asampurna phalam, their bala will be less. They are having less timid. Madhura Satyam, they are very fond of Madhura article. Ahara Sankha Anyatavani, they will take all variety of food items. They don't know which food item is good for the body. So because of that, they will suffer from mandhavi or improper digestion. If you are seeing some studies, 6% of children less than 6 years present with recurrent respiratory infections. In developed countries, up to 25% of children aged less than 1 year and 18% of children aged 1 to 4 years experience recurrent respiratory infection. Next, acute respiratory infections are responsible for almost 20% of all deaths of children aged less than 5 years worldwide. Next, risk factors for acute respiratory infection. What is acute respiratory infection? Acute infections of the respiratory tract and its related structures. Okay, here duration is less than 30 days. But if middle involvement is there, middle infection is there, its duration is less than 14 days. Okay, such infections we are calling it as acute respiratory infections. What are the risk factors for respiratory infections? See, rhinitis, it is 1% for the acute respiratory infection. Bronchitis 43%, tonsillitis 19%, acute otitis media 14%, pneumonia 31%. Contributing factors for pranavaha stotovikaras. See, first of all, anatomical and physiological condition. So here, children, they are having short trachea. Trachea, it is narrower, smaller, and it is shorter. Narrow airway. Next, secretion of the mucus. You are knowing there will be hyper secretion of mucus. Underdeveloped paranasal sinus. They are having less immunity. If you are seeing East Asian people, it is straight, short. So these are the points related to anatomical and physiological condition. That is why they are more suffering from pranavaha stotovikaras. Next, if you are seeing improper food habits, already I said, because of that, suffer from mandhavi. Then application of murraya, it is very common, especially in rural areas. They will not consider this climate changes and all. Especially in the rainy season or winter season, they will continuously apply means oil on the head. Because of that, will suffer from pratishaya. Then patya consideration is very difficult to give guidelines to the children. If you are giving guidelines also, children, they will not follow patya apatya. So that is another one important contributing factor for pranavaha stotovikaras. And next is hygiene. Nothing is there to explain in that. Then environmental factors, especially dust and nowadays pollution is developing more and more. And moreover, in a nuclear family, what we will do means this package, it will be there inside the house. Night time we use mosquito repellents. Then especially children residing in the industrial areas, they are continuously exposed to the smoke and all. So this is a very important contributing factor for allergic type of bronchitis and all. So it is also very important contributing factors for pranavaha stotovikaras. Next is stanya dushti. That Shapa said, Garbini, whatever Pana Garbini is taking, it should be stuck to the child. Otherwise, the child will suffer from so many diseases. While Garbini is taking food, how to consider Kala, then Agni, that all the things, that is very important. We will discuss one by one our today's topic. First topic is Pratisha. Definition you are knowing. Vatam prati abhimayo gamanam kapadinam yatra sa pratishaya. Dallana. See, here we can see two words. Prati means opposite direction. Shaya means movement of the doshas. So here kapadi doshas, which is emanating out from the nose, that is pratishaya. Next, pratikshanam shayati iti pratishaya. It is some shabda kalpadruma. So here kapadi doshas continuously eliminating out the nose. So that is the definition of pratishaya. Next, Nidana. See, in general, I am giving here Nidana. Okay, it is told by Saraka as well as Ashtanga Hridaya. There, that Acharya's reference I have taken here. See, Nidana here, some of the important points are noted. Sandharana, Veka Sandharana, especially and Purisha Vekadharana, Ajirana, then exposure to Raja. Raja means a dust. Atibhashya, excessive speaking, Rutuvaishamya, commonly in around Rutu Sandhi, okay, especially early rainy season, then winter season. These are the contributing factors. These are the Nidanas. Then Shiro Abhitapa, excess exposure to the sunlight. Then Atiswapna. Atiswapna means here taking day sleep more. Then Shitambo, if you are taking drinks. Then Avashya, if you are exposure to the mist, then excessive tears, excessive exposure to the smoke, dhuma. Okay, so all the contributing factors, these are the positive factors according to Charakacharya. Sorry. Next, according to if you are seeing Nidanas, Avashaya, in Tushara, that is exposure to mist, exposure to the wind, exposure to dust, then Atibhashya, excessive speaking, then Atiswapna, then Pitena Varina. See, this point is very important while considering the children. See, where children is residing, that area is sadhana to the child. If child is going another area and taking water from there, that is Vijati Jala. If child is taking such Jala, then it will come from Pratishaya. Then Atyambupana, taking excessive water, what will do because the Mandagni? Or after taking food, if you are taking water, then it will also cause the Mandagni. Very important. Another one factor is Ramana. Ramana means or excessive playing under sunlight. See, all the positive factor according to Ashtanga or Pratishaya. Next, if you are seeing Kashyapa reference, Kashyapa Sudana, 12th chapter, query 12th chapter, you will get this reference, Satatam Vividha Sanya Pitva Pitpati. If child is taking varieties of Sanya, suppose Gabri Sanya as mother milk or cow's milk, if child is taking and sleeping, it will cause the Pratishaya. Then, according to Charaka, you are knowing Ashtavidha Sanya Duti, in that one is Pena Sangata Kshira. If you are seeing its features, there you will see the one is the important lakshana if child is taking Pena Sangata Kshira. Next, Pura Rupa. What is the Pura Rupa of Pratishaya? Shiro Gurutvam, there will be heaviness in the head, Shavato, frequent sneezing will be there, Angam, pain all over the body, Parivishta Romata, horripilation will be there. Some of the Upadravas like Var Arudata, etc. These are all the Pura Rupa of Pratishaya. Next, seeing Samprati, Chayam Gata Murdani Maruta, Tatak Samastascha, Tataiva Shonitam, Prakovyamana, Vividehi, Prakopane, Grana, Pratishakara Bhavanti, Tushruta Uttara. Here, due to Nidanas, Vatadi Doshas, Vata, Pitta, Kapha, individually or in combination, Samastascha, in combination, along with Rakta, due to these particular positive factors, it will aggravate and accumulate in the head and it will cause the. Next, according to Acharya Kashyapa, see only one reference we are getting about penis in Kashyapa Samhita, in Samhita Vedanadhyaya 25th chapter. What is the Lakshana according to Acharya Kashyapa? Murmukena Upasiti, Pitvam Stanyantuyaha, Sravapasi Kichasya, Lalatam Cha Abhitaptati, Sonam Prashati, Pinase, Shauti Kasati. 25th chapter, that is the reference. What it will do while taking breast milk, it will take breath from the mouth. Okay, mouth breathing will be there. Sravato Nasiki, there will be discharge from. If you are touching the forehead of the child, will feel the rise of temperature on the child. Sotansya Abhikshna Krushati Pinase Shauti Kasate. Repeatedly, child will touch the nostrils. Sotasyam Krushati. Then frequently, child having Shavatu. Shavata means skin, Kasa, cough. So these are the Lakshanas of Pinasa according to Acharya Kashyapa. Next, Veda. total 5 varieties of Pratishaya: Vataja, Pittaja, Kafaja, Sannipaja, as well as Raktaja. If you are seeing reference, he said only 4 types, that is Vataja, Pittaja, Kafaja, as well as Sannipaja. Next, one by one, we will see the Lakshana according to dosha of the Pratishaya. So here, Vataja Pratishaya Lakshana. Here, I have Sushruta reference as well as Ashtanga Hridaya reference. Ananda Pihita Nasa, Tanusrava properties. The only important points I will tell here. Ananda Pihita Nasa, there will be Admata, nasal obstruction will be there. Pihita Nasa means there will be Raja Shuka Purnamev, nose, patient will be having feel like nose is filled with Raja, Shuka, etc. And very importantly, Tanusrava, Srava will be thin, discharge will be thin from the nose. And the Talu, Oshta, Shosha will be there. Dryness will be there, resolve the region. And there will be pain in Shankar region. Swaropaghata will be there. So these are the Lakshanas of Vataja Pratishaya according to so we are taking Ashtanga Hridaya reference. Shabatu, frequent sneezing will be there. Granoda will be there. Nasal obstruction will be there. As Yitika Yuva, Sarpanti Manyati, Parito, Bruvai. Okay, so around Bruce, patient traveling around like that patient will feel. Then Swarasatya, Chirat Paka, it's it will take longer time for its suffering. Then nasal discharge, how it will be? Shira, it is cold, acha, it is clean. So here, very importantly, what is the Pratishaya means that you have to remember there will be Nanusrava. Srava will be very thin. Along with that, Latalo, Shosha will be there, repeated will be there, Granoparoda will be there, and Shruti, that whatever discharge from the nose, it is clean. Next, Pittaja Pratishaya Lakshana. Ushna Hasa Pittaja Sravo, Grana Sravati Paitiki. So here, Ushna Srava will be there from the nose. Sahapita. Sahapita means Ishat Pita, little bit yellowish color of mucus. It is coming from the nose. Then Santapta, see, very important here, fever will be there or rise of temperature will be there. Patient will feel Sadhuma Sasavani Vativata Manavaha. See what fumes it is coming out from the nose, like that patient will feel. So if you're considering Ashtanga Hridaya Lakshanas, that will be Krishna, Dwara, Grana Pitika, eruptions inside the nose. And there will be Nasahagrapaka, there will be tension in the tip of the nose. So these are the Lakshanas that we see in the Pittaja Pratishaya. So here important point, so remember, Ushna Sapitakaha Srava. Srava, it is having little yellow in color. Then Jwara will be there. So Nasahagrapaka. So these are the things you have to remember. Next, Pratishaya. Kafakrute, Shitaha, Sraven Mumu, Shukravapasah, Shunaksho, Bhavet, Guru Shroku, Chira, Gala, Ushta Talunam, Kandu Ativacha. So it is from the Uttara reference. So in Kafaja Pratishaya, whatever secretion is coming from the nose, it is Shita, it is cold, and its color is white. Okay, which color? Mucus, it is coming from the nose. Okay. And very importantly, Guru Shiro Mukha, there will be heaviness in the Shira as well as Mukha region. And